Stephanie with 9 Health, and this is Health Happens, the show we do every Tuesday right here on Facebook. Last week we talked about men's health because June is Men's Health Awareness Month. You'll find that on our website, 9healthfair.org, or their Facebook page if you missed it last week. But today we're talking about cataracts because it's also Cataract Awareness Month, and maybe you know what those are, maybe you don't. We're here to find out treatments, if you can prevent them, all those things. I'm with Dr. Bill Richheimer, and he's with the Mile High Eye Institute. And you're an ophthalmologist.
Yes.
Tell me what that is for people that don't know the difference between an optometrist and ophthalmologist.
Yeah, so there are basically two kinds of eye doctors, optometrists and ophthalmologists. Optometrists generally participate in yearly eye care and certainly glasses, contact lens prescriptions.
Regular eye exams.
Regular eye exams, and in a number of cases can manage eye diseases like glaucoma, keratoconus. But when it comes to surgical eye diseases, you really need an ophthalmologist. Okay. So as an ophthalmologist, I went through 4 years of medical school, followed by internship, residency, and then in my case, fellowship training. And much of it was revolving around medical care of the eye, but a large proportion was around surgical care of the eye.
Okay, so that's one of the big differences. You can do surgery on our eyes.
That's the line.
And with cataracts, that's a treatment. So we'll talk about that in just a moment. But first, we're in one of the surgical suites here at Mile High Eye Institute. So tell us, what's in this room? Just give us a look at what is in here, because it's kind of a cool room. And you can do other stuff in here. You don't just do cataract surgery. There's other stuff that goes on.
That's correct. So a lot of technology, a lot of money, a lot of fancy toys, and a lot of fun stuff.
Right.
Right behind you is a cross-linking machine.
This one?
Yeah. And this is a relatively new machine. This is something that was FDA approved in April of 2017.
Okay.
No, April of 2016, so right about 3 years ago. We've been doing it for a while as I was involved in an FDA study for it. But cross-linking is a procedure that can help stabilize a condition called keratoconus. Keratoconus happens when the cornea bends into an abnormal shape. And that can cause distortions in your vision. It can even lead to blindness in a more severe form. Is treatable through a cornea transplant, but really that's something you want to avoid if at all possible.
Right.
And in the big picture, corneal cross-linking, by essentially freezing the cornea into place, not by temperature changes, but by strengthening and stiffening the cornea.
Freezing in time.
Exactly. Can help stop a disease process that would otherwise be progressive.
Okay.
And so it's a hugely important tool for us, essentially lowering the rate of cornea transplants and really helping people preserve their sight.
Kind of a less invasive.
Much less invasive process. Yeah, so really it's an amazing technology that's only been around for a few years.
Interesting.
If you have keratoconus, very separate from cataracts, something you may want to look into.
Yeah, again, we're talking about Cataract Awareness Month and cataracts, but you guys do a lot of stuff here, so we're just getting a tour around this surgical suite before we really get into cataracts.
Exactly, yeah, and as we pan to the left here, some of this technology that you're about to see is devoted to LASIK and PRK, which are collectively laser vision correction. So if you have a high prescription, if you're nearsighted, farsighted, even with astigmatism, laser correction is one of the options. There are others, but one of the main options we use to basically put people's eyes into better focus.
Okay.
The technology around it, as you may imagine, has evolved tremendously in the past few years.
Yeah, I have family members who have gotten it done, and when you can first get it done, you really had to have a specific type of vision loss or condition to be able to even do LASIK.
Initially, it was just treated for myopia or nearsighted, where you can see close but not far.
Right.
And that still works and more accurate, perhaps, than it had been in years past. But now we have an expanded range of treatments we can do.
Great.
And the tracking systems have improved dramatically. In other words, if you move just a little bit, the laser moves right away with you. So really, the safety factor has gone up, and the technology is just evolved.
Nice. Okay.
Yeah.
So what else happens in this room in addition to cataract surgeries?
Yeah, so apropos of Cataract Awareness Month is a machine called the phacoemulsification unit, really an amazing technology that is used for cataract surgery and another surgery called refractive lens exchange.
Nice.
This is basically a tool or device I use to soften and remove a cataract.
Okay.
Essentially, cataract is something that's inside your eye. It lives behind the pupil, and it represents a normal structure of the eye when it gets cloudy. So behind our pupil, we all have a lens in the eye, at least the vast majority of us do.
Right.
And as you age, that lens can undergo some changes where it goes from clear to yellow or amber. and other structural changes that just make it less transparent over time. Sometimes it can be subtle at first.
Yeah,
but over
we had said
time-
kind of cloudy in our description, so kind of cloudy-ish.
Well, for some individuals.
Okay.
But that, I would say, is an overgeneralization. Because
Okay.
for some individuals it's cloudy, for some people they just see glare. One of the classic early findings in the setting of a cataract is just trouble driving at night because glare, sort of streaks of light.
Okay.
And the reality is it's different for different individuals. Some people have pretty nice vision under normal lighting circumstances. For
Okay.
example, daytime driving, they feel like it's perfectly fine. But night driving might be terrorizing because if they're oncoming SUVs or trucks,
Right.
oncoming light in the setting of a cataract can be really difficult. And sometimes in a two-lane county road can be dangerous.
Right, yeah.
And in certain instances, it's all attributable to the cataract, meaning it can be fixed.
Right.
And, in a lot of circumstances.
Let's sit down. We'll
it's
talk a little more about
yeah.
it. Again, we're with Dr. Bill Richheimer, and he's at the Mile High Eye Institute, and we are talking about cataracts because it's Cataract Awareness Month.
Yeah.
So we just went over what a cataract is. How would and we kind of talked a little bit about this, but how would someone know they have cataracts? Like, I feel like a lot of my relatives will say they don't like driving at night or have trouble driving at night.
Right.
We just talked about that. Is that a sign for everyone that maybe cataracts are on the horizon
Yeah.
or starting?
Yeah, that is a symptom
Okay.
of a cataract, but in fairness, that can be a symptom of other eye diseases, other eye conditions as well. So it's not totally specific to cataract. And the reality is there's no one surefire way to self-diagnose it yourself with a cataract.
Okay.
Really, you have to see your eye care professional. And your optometrist or your ophthalmologist can help you with that diagnosis.
And if you're seeing your optometrist or ophthalmologist yearly, annually for eye exams, you should kind of track, they'll track those changes, right? You kind of, the doctor would notice that that is starting to happen.
Exactly. And it's a very common thing that your optometrist or your ophthalmologist may tell you, you have an early cataract. That in and of itself doesn't mean you have to have surgery. In fact, if you are told that you have an early cataract, but you feel like from your perspective that your vision is good, that even if you need glasses that they're still working, then generally speaking you don't need surgery. The
Okay.
existence of it is really not enough. It's when you have that cataract and it's causing you some limitations.
Okay.
So if you feel unconfident driving at night and that's attributable to the cataract, that's when you want to start to think about surgical care.
Okay. And if you haven't been to your eye doctor, you know, in the last year and you start noticing some trouble seeing at night or anything like that, then it's probably time to go get them.
That's
right?
the main thing,
Okay.
yeah, because
When to know to go in to the
yeah, and it's really an amazing surgery to the extent that results are very impressive. They're very reliable. There is no such thing as a 100% risk-free surgical intervention.
Right.
That doesn't exist. But cataract surgery, it's rare to have complications. It's rare to have unhappy outcomes. And generally speaking, for most individuals who seek surgical care for their cataracts, they have great results. And that's one of the reasons I just love doing this surgery. And it's the number one surgery performed in my practice, number one surgery performed in the United States.
Oh, wow. So they're common. And I did want to ask you, who's at risk of developing cataracts? Are we all just going to eventually get them? Does everyone get them to a mild degree as we get older?
They do. And
Okay.
if you live long enough, you'll get a cataract. So if you're in your 90s and you haven't had cataract surgery, almost certainly you have a cataract. But it's really just very common with age to develop a cataract. They can develop at different rates for different individuals.
Okay.
Genetics may be part of the determining factor there, but certain environmental conditions and medical states can accelerate a cataract.
Okay.
Diabetes can accelerate a cataract.
Right.
Alcohol or tobacco can certainly accelerate a cataract. A poor diet.
Yes, like most things we talk about, having a healthy diet, not smoking as much, not drinking as much. You know,
Yeah.
things in moderation or not at all.
Not at
Makes
all.
you
But
healthier
they,
overall.
yeah, with respect to smoking, it's really, you know, moderation's
Right.
not what we want. It's really 0 is the number we hope to get to.
Right.
But alcohol in moderation probably does not cause significant cataract, but certainly in excess
Right.
can.
We have a question from Facebook, I think. So if you have questions, go ahead and ask them, and Kat, who's behind the camera, will let us know.
Yes,
If
we
you
have
one.
We do. We have a question regarding Medicare coverage for cataract surgery. Does Medicare cover cataract surgeries.
We kind of talked about that
Yeah.
because you were talking about the surgical suite here. Depending on what kind of coverage you have, it might be here, it might be somewhere else.
Right. As a general principle, Medicare does cover cataract surgery.
Okay.
Now, there are criteria that exist, thresholds that exist by which Medicare will provide coverage. And essentially, there should be functional limitations. They don't have to be severe. But for example, if you have trouble driving at night, you don't feel confident driving at night, and that limitation is attributable to the cataract, then it should be covered through Medicare.
Okay.
There's a thought that, well, I have to be 20/60 or 20/50. If I'm 20/30, it's impossible for me to have insurance coverage. And the reality is that's not true.
You can still have good vision and have a cataract that needs to be taken away.
Yeah. If you have perfect vision, probably not. And
Okay.
probably it's considered elective or
Okay.
even sort of cosmetic from a Medicare standpoint. But if you have functional limitations that glasses can't correct due to a cataract, then it should be covered.
Okay. And we've been talking about cataract surgery. Is that the treatment, the only treatment if you have cataracts? Is there anything that you can do before surgery to see if it helps?
Yeah, so in the early phase of cataracts, it's not necessary to have surgery. Occasionally, a glasses update will put your eye into better focus, and if that solves the problem, then you can live with the mild cataract for a while.
Okay.
But for better or worse, there is no eye drop or non-surgical cure for
That'll take
cataract.
them away.
Yeah, and there's really no proven way to stop the progression. Certain factors can help, as we discussed, using or having a healthy diet, clean
Right.
living, protecting yourself from excessive ultraviolet exposure, especially at the mile high altitude that we have.
So sunglasses
here.
help?
Sunglasses may slow the progression.
Okay.
They won't stop it or reverse the changes.
Okay.
But in general, they're a good habit to be into. But to cure cataract, you really need to have surgery.
Okay.
for it.
And we've talked about this a little bit, but there's really no way to prevent them. Like having a healthy diet, not drinking, not smoking, those are healthy lifestyle measures that could help, I guess, lessen them or maybe they start later.
Yeah,
But there's really no way to prevent them.
that is basically correct. If you live long enough, you're going to get a cataract. And the good news there is, to a certain extent, it's a guilt-free condition.
Right.
It's not the vegetables you didn't eat. Eventually, you get a cataract again if you
It's
live.
just whether or not it's severe enough to need surgery.
Exactly.
We have another question from Facebook.
Yes. Is an ophthalmologist referral adequate for evaluation?
Should be. Yeah. There are some types of ophthalmologists that don't treat cataract surgery.
Okay.
So we have pediatric ophthalmologists that may not focus on that. But
Because kids
typically,
don't really have them.
yeah, there are exceptions to that. But in general, if you're getting a referral to an ophthalmologist, usually that's enough to get the process going. And typically, you'll get a referral to an ophthalmologist who performs cataract surgery.
And we're in a surgical suite where you perform other surgeries, but cataract surgery is one of them. Just walk us through a little bit what happens. It sounds scary to me to have your eyes operated on. You
Yes.
said it's a pretty safe procedure, so just talk about what exactly the steps are for
Yeah.
cataract surgery.
Happy to do it. So, on the day of surgery, typically there's some administrative things and some
Right.
paperwork we do, but usually we talk you through the process and go through so patients have an envisionment of how it'll feel, what it'll be like. In my surgical practice, we typically give pills to relax you.
Okay.
They don't necessarily knock you out. There are exceptions where we'll use IV treatments or even deeper gas sedation, so people are totally asleep. But for most individuals, we put you into almost like a twilight state where you just feel very relaxed on
Okay.
account of some pills that we give you.
Okay.
And once they've kicked in, you're brought into the operating room suite. You get a lot of numbing drops. So the numbing drops are topically administered. There's no needle that I
Okay.
use. Different ophthalmologists have different protocols. So on occasion, some will inject numbing medicine through a needle, but that's not something we do because typically we find it's not necessary for comfort. And then your eyes cleaned with an iodine-based solution to make sure it's sterile. A number of sterile drapes are used, and they're sort of tented over so you don't feel too claustrophobic. Of course,
Okay.
the pills help with that.
Right.
For perspective on the whole thing, often you're here for about an hour and a half, but the surgery itself takes, in my hands, about 7 minutes.
Oh wow. I thought you were going
plus
to say
or
like a half
minus.
hour. 7 minutes
Yeah,
for cataract
yeah.
surgery. That's amazing.
So it's typically
Is that with both eyes? Or would that just be one eye?
that's
Is it-
one eye.
Okay. Is
And
it typically
traditionally it's
just
one eye.
Okay.
There are exceptions to that. Traditionally, and partly this is for insurance reasons, we stagger the two eyes
Okay.
1 to 2 weeks apart.
Okay.
Sometimes we do them on the same day. There are different factors there and individual choices. But in most circumstances, especially with Medicare, we do it 1 to 2 weeks apart.
Okay. But 7-minute surgery and with laser?
Yeah, so the primary technology driving this machine here is ultrasound, also called phaco emulsification.
Okay.
It was developed in the 50s and 60s. And the bigger principle is that the cataract is a certain size, a little smaller than a non-peanut M&M, but it's much bigger than the incision I create for the surgery. The incision is tiny. Now that, of course, is fundamentally a good thing.
Yeah.
In general, for surgery, a smaller incision size means a less invasive surgery. But what it also means is to remove the cataract, we have to break it up. You can't remove it in one piece. That was sort of the older technique for doing it.
But a bigger incision.
Yeah, exactly. So that would be the downside of that original technique. And to break it out, we need a technology to soften it and to kind of break it into little particles. And that's where this phaco emulsification is taken. Now there are laser forms of this as well, but the phaco emulsification is sort of the most tried and true, and the one that works in my hand for a very efficient surgical process.
Nice. So again, we're talking about cataracts. It's Cataract Awareness Month. We're with Dr. Bill Richheimer at the Mile High Eye Institute. If you have any questions, put them in the feed. We can get them answered. Do we have any more right now? No? And if we sign off and you have more questions, you can put those in there and we'll get them answered later. I do want to ask you, if you leave them untreated, a cataract, is it just going to end the treatment being surgery, I guess? Do they just progress and get worse and worse and worse?
They do.
Okay.
The rate at which they progress is variable.
Okay.
And
it
they
just
can be
depends
a
on the
little,
person.
yeah, sometimes they progress incredibly slow. Sometimes like a crack on the windshield of your car, it just seems the same forever.
That's a good analogy.
But then all of a sudden it seems to propagate.
Right.
And it's an apt analogy because our lens is also called the crystalline lens. It's made of proteins that have a highly organized crystal-like structure, just like glass on a windshield. And so the way they propagate is sometimes similar. And so while we are often teach that they grow gradually, sometimes from your perspective, if you have a cataract, it seems like the changes come on very quickly as they cross a threshold and come into the center of your vision.
And then if you want that treatment, it would be surgery to
Exactly,
fix it.
yeah. And if you delay the surgery, typically nothing catastrophic happens. You're delaying the potential for better vision you could have had sooner.
Right, that's true.
But you're not burning bridges. There are exceptions to that where it's dangerous to leave a cataract. But for the most part, it's okay to wait a little bit. If you have a cataract that's treated later than it should, you can still have a successful result.
Okay.
So if you've been one who's really wants to kick the can down the road, you're not harming yourself. Again, there's some exceptions to that.
But again, sounds like a simple, safe surgery. Is is we didn't talk about recovery from it pretty easy?
For most individuals it is. And of course, the recovery is not the same for all individuals, but
Right.
after a typical cataract surgery, on day 1 afterwards, sometimes the vision's blurry or foggy,
Okay.
but often day 2, day 3, day 4 turns the corner. So vision recovery is not immediate, but it moves along
Right, at
very...
first you're like, wait, I thought it was supposed to be clear vision, right away.
and the evening of surgery is sometimes very
Yeah,
foggy. But it really recovers very quickly, and even on day 1, some individuals love their vision. And other individuals feel like it may not be great, but it's progressing, and
Okay.
often hour after hour they just notice.
Probably depends on how
progressing.
bad off you were before you had surgery
That's a
too.
big factor.
Right.
Absolutely.
All right, was there anything else you wanted to add about your practice or about cataracts that people should know?
Yeah, one of the things we talked about with respect to LASIK and laser vision correction
Mhm.
is that a broader range of prescriptions can be treated.
Right, yeah, because I had mentioned, when it first came out, it seemed like it was a very narrow segment of the population that could have LASIK.
Right, and the truth is with cataract surgery, the technology around it has expanded tremendously as well. And now we have not just one size fits all for the lens implant. As I mentioned, the cataract is really the lens of the eye when the lens gets cloudy.
Right.
And so with cataract surgery, it's not just the matter of removing the lens,
Oh, right.
but replacing it.
Right.
And the tiny lens goes folded up and unfolds inside the eye through this tiny incision. But there are choices and technology developments in the lens implant that really broaden what we can do and what we can offer visually afterwards. So for some individuals, we can get vision, even if they had a huge prescription and can only see up close, get vision to where it's really great distance vision.
Oh, that's
And
amazing.
people can see and hike without glasses, whereas they may not have been able to even consider that prior to cataract
Right.
surgery. So it's really not just a matter of clarifying the vision, but with modern technology, there's the possibility of putting your eyes into much better focus than they had been.
Nice, like bionic eyes, improved eyes.
Yeah, literally with the artificial implants,
Right.
they are basically bionic.
That's cool.
Some of the technologies become more expensive, and so there are types of lens implants that Medicare doesn't cover.
Right.
But those upgraded implants can provide people with near and far vision
Very cool.
simultaneously. And so not everybody's a candidate for every type of lens implant, but to find out your options, you really want to discuss with your ophthalmologist.
Yeah.
Because it's not just a matter of getting better vision, but sometimes really enhanced freedom from glasses, which can be a bit more wonderful.
Free.
Yeah.
All right. Awesome. Okay, well, and any other questions on Facebook?
Not so much questions, just comments.
Okay.
Thanking us for providing the information.
You are welcome.
And remember, it looks like we have a couple of your patients in here. So
Oh, wonderful,
they're
yeah, I
saying
guess.
hello.
This is
Yeah,
Dr.
hope you're all doing
Richheimer.
well.
Thank you for watching.
So, no
Hopefully you're
problem.
seeing this very clearly.
Yeah, that's right.
Okay, well, we're going to sign off from here. If you have any additional questions, you can put them in the comments and we will get those answered for you later. Thank you so much for joining us.
Yeah, absolutely. Thank you.